the National Chair for Kenya Union of Clinic Officers. We are here today on unprecedented developments that we have seen coming from the Council of Governors. I think it is in the public knowledge that on 1st of January this year, we came out and on the steps of the Afya House, together with the CS Health, that we said we decided to compromise so that we can give Kenyans a New Year's gift by ensuring that we are at workplace at a time when we are going to see Kenyans and our students going back to school, which means, of course, there will be increased interaction and, of course, surge in COVID infections. And therefore, it was of utmost importance that we be back to work to ensure that we take care of any eventuality. We as the union decided to compromise. This decision was taken under the multi-agency standing committee that had been sitting under the Ministry of Labor, under the stewardship of the CS Labor, CS Chelugui, and with which we were able to come up with the agreements, the 17 agreements that we were able to sign off. I must also say that by the time we were signing, the Chair Council of Governors and the Chair Labor Committee Council of Governors were fully briefed and gave their consent for us to be able to go ahead and sign this agreement. We were taken aback and shocked yesterday when we saw a communication from the Council of Governors negating their previous stand about the issues we agreed upon. What is even more shocking than that is that they have stood and told the public that we have been going on strike for issues that they had already addressed. If you look at their own letter, they are admitting to the fact that they have no compensation for any clinical officer who is going to die in line of duty for their families, and their families will have to live in destitution because their father or mother decided to be on the front line and to fight and protect fellow Kenyans from the scourge of COVID. And so we are wondering, this doublespeak, today they tell us that they have taken care of everything. In fact, the governor of Kisii has even gone ahead and wants to dismiss nurses and clinic officers, saying that whatever they're asking for, he has already provided. Now, yesterday, he's telling us that they do not even have the capacity to implement the group life cover that compensates anybody who dies from COVID-19. And so you can see sometimes the indifference that we are subjected to as a union, and the reason sometimes, even in the middle of pandemic, we have to come out and go on a strike. Because I think if you are looking for a justification as to how we can actually go into a strike during a pandemic, I think you now do have a reason. We have been told that, yes, your working environment is not safe. If you are going to die, we are not going to compensate you. And if you go on strike, we are going to sack you. What kind of an employer, if not a hostile employer, is going to do that? So, especially for the KMPDU, that Governor Ongwae had already actually signed. It's only His Excellency Governor Wycliffe Oparanya, the chair, who did not sign. But now they are telling us even that one does not stand. That we are supposed to go and sign the return to work formulas with individual counties. And then you wonder, the communication they did yesterday was in the recognition that the Council of Governors is the authority that speaks on behalf of the 47 counties. When it comes to something that does not suit them, then it is no longer convenient for them to use the Council of Governors, and now they want to tell you to go back to the counties. So it has become a tool that is used to frustrate health workers whenever we are trying to advance very genuine issues. And I think we are here today to say that we know the government, from His Excellency to the CS Health, His Excellency the President to the CS Health, they have the goodwill, and the Council of Governors has been fully briefed and has participated up to the last decision under the multi-agency committee. And so we cannot actually be taken back by politics, by playing politics with issues that are central to the right to life and to right to highest attainable standards of health as provided under the Constitution. Let me also say this, and it's good for Kenyans to know. Do not think that the COVID-19 infections have gone down. When the health system is working well, we are the people who send these people for the tests. The reasons as to why you are seeing low numbers being given daily, it's not because the curve is going down. It's because the health system is not working. And that is why we decided to come and compromise, so that we can at least go back with an agreement on how we are going to ensure that the working environment is safe. But now, yesterday we were told we do not care. You have to work either way. If you die, it's upon you. And if you don't work, we sack you. And so that is the environment that we are being told to work under as the health workers in this country. So we are telling them that we are putting them on notice, the Council of Governors, so that if the return to work formula is not going to hold, then that means that also calling off the strike, because it was one of the agreements under, is not going to hold, and we shall be going back on strike. So we will be giving them 2 days, 48 hours, for them to be able to come together, harmonize and agree, and sign the return to work formula that has already been signed by the CS Health, so that Kenyans can be able to enjoy health. I'm saying it's unprecedented because we never thought that a Council of Governors would ever call the medics to go on strike. But actually today, what they have done, they have told the union that we went back to work too early, and they need us to go back to strike. And then, of course, they are going to tell us when to go back to work, because they are the ones who have refused to sign the return to work formula.